Coming up today, a persistent cough led Jenny Johnson to a diagnosis she never expected.
Oh, my daughter's crying, I'm crying. It was like a slap that you've never experienced in your life.
Good morning, I'm Jessica Lovell, and welcome to the Morning Medical Update. Jenny Johnson was healthy, active, and a non-smoker, but a lingering cough led to tests that revealed stage 4 lung cancer. She was given 3 to 5 years to live. 7 years later, Jenny is still here, thanks to advanced testing, targeted therapy, and care at the University of Kansas Cancer Center. Jenny Johnson has always lived an active lifestyle.
I was always healthy, ate healthy, didn't drink excessively, didn't smoke. Never really worried about anything.
Even a persistent sinus infection and cough didn't seem like a big deal at first. But after 5 weeks, she saw her doctor.
I went in for a chest x-ray thinking, okay, no big deal. I get a call later from my internist, and the doc said there was a little asymmetry in your lung field, so it warrants getting a CAT scan. And again, I'm thinking, okay, that's fine. I've got this cough. I was thinking pneumonia.
It was more than that.
Cancer was the last thing in my mind. And my doctor calls me. We'd had a long relationship, and he said, Jenny, I hate to tell you this, but you have a mass, and it's likely cancer.
Jenny chose the University of Kansas Cancer Center.
It felt so strange walking into the cancer center, and I'd look around, and there were people with no hair and pale and frail, and I kept saying, I don't belong here. This is not me.
She got started with her cancer team, which included medical oncologist Dr. Chow Wang. She had a bronchoscopy and biopsy. Jenny just wanted the mass removed, but the news wasn't good.
He looked at me and he said, unfortunately, that is not an option as the cancer has spread. He says, you also have lesions in your brain, 27 at least that we can count. I fell to the floor. There wasn't a dry eye in that room. I meant, no, it can't be. So I walked out of there that day with a diagnosis of stage 4 non-small cell adenocarcinoma with a life expectancy of 3 to 6 years.
That was 7 years ago.
And I'll never forget the day I got that phone call. I was sitting down and they said, you are positive for EGFR.
EGFR is a lung cancer mutation. It qualified Jenny for a specific targeted therapy for her type of lung cancer.
Oh my God, it's like, okay, I've got cancer, but if I have to have it, yes, this is great, because there is a medication that's been approved that treats that specific mutation that I have. And it is a form of targeted therapy, so I simply take a pill every day, and I have for the past 7 years.
Jenny continues surveillance treatment and is fighting back against cancer and living life for her grandkids.
I don't plan on giving up. My whole goal is to prove my doctor wrong. I'm stubborn, and I have a very strong will.
Yes! Yeah, nice shot, right? Yeah. Nice shots. Jenny Johnson is joining us here in our studio this morning. How's the golf game going these days?
I need to start getting out there more. It's warming up, and plan to hit the links a little bit more this summer.
I bet you do. Well, we're so glad that you are here joining us with members of your care team, oncologist Dr. Chow Wang and radiation oncologist Dr. Krishna Reddy. Jenny, I want to start with you. What was the most difficult part to come to grips with when you first got your diagnosis?
I looked at it as a death sentence, and I was thinking it's too early. I wasn't ready to go yet. I had my kids, my grandkids, I had a full life I thought ahead of me. So I think the hardest thing was looking at my mortality, the confusion that set in, the uncertainty, and
Dr. Wong, how common is lung cancer in non-smokers?
So about 10 to 20% of lung cancer occur in non-smokers. It's not that common, but unfortunately it does happen.
So when you first meet a patient like Jenny, what is the most important thing that you're first trying to determine early on?
Right, so just the non-smokers fortunately has this genetic mutation called EGFR along with the other mutations. So the first thing we're trying to determine, does the cancer has any of these mutations that we can use a targeted therapy like EGFR.
So Dr. Reddy, Jenny was told she likely only had a few years, kind of 3 to 5, 6 years. What advanced treatments have made it possible for her to be sitting here with us today, 7 years later, sharing her story?
Yeah, absolutely. On the medical oncology side, as Dr. Wong alluded to, I mean, we've gotten so much better at getting kind of an individualized kind of profile of people's cancers through genetic testing and genetic sequencing. And now we have targeted therapies that actually go after the particular driver mutations for many people's cancers. Of course, there's many more yet to be discovered, but there's so much research going on through clinical trials. On the radiation oncology side, we've developed the ability to really deliver very highly localized radiation very safely to even very sensitive areas. And kind of these two kind of developments in conjunction have really allowed us to get just better control long-term of cancer.
Well, we hear the term targeted therapies. Kind of explain to our viewers and listeners what that means.
Yeah, I mean, targeted systemic treatments are treatments that are basically that are systemic treatments, meaning they're given oftentimes in pill form, sometimes by IV, but they go through the whole system, and they exploit the fact that cancers have particular markers on them, and when there's particular markers that are driving someone's cancer, these targeted therapies can kind of go after those markers, block them, and kind of inhibit the growth of cells in a very specific, very focused way, rather than kind of a bigger shotgun approach.
Jenny, when you found out that your cancer had spread to other areas like your brain, what was the most concerning at that point?
It just seemed a little more devastating, more real. We were worried initially with so many lesions. What if I had a seizure? What if I had anything else that would incapacitate me more? I'm very strong-willed, and I hate to depend on anyone else. And I didn't want to be a burden to my children, my family, or anyone else.
I doubt you were a burden to those you love. You're depending on family and friends. You're also depending on medications and treatments during this time. Were there side effects to these treatments for you? If so, what were they?
We can laugh about them because I found that's the easiest way to deal with it. But and overall, this medication for me has been very tolerable. I've had a great response to it, and I cannot complain. Fatigue is probably one of the biggest things I deal with. So luckily I have little grandchildren who still need naps, and it's nothing better than cuddling up with a little one in your arms. But,
oh, that's a good positive way of looking at it, for sure. Dr. Reddy, when Jenny developed new lung tumors, how did you decide that radiation and not chemotherapy was the best option for treatment?
Yeah, I mean, this was a decision that I made in collaboration with Dr. Wong, as we always do, kind of work as a team. In Jenny's case, each time she presented with a lung tumor, it was really the only site of progression, meaning all the rest of the cancer was well controlled, practically invisible on the targeted therapy, and it was just this particular lesion that wasn't responding, that was kind of resistant to the targeted therapy. So for that reason, we were able to use very localized radiation to just basically eliminate that one resistant spot that wasn't listening. And as other spots have come up, we've similarly approached things.
And Dr. Wong, what are the challenges of treating lesions on the brain?
So the brain is a sanctuary site, as we call it. It has what we call blood-brain barrier. So a lot of times, some of the intravenous therapy that we give doesn't penetrate into the brain tissue very well. Fortunately for the targeted therapy like erlotinib or semetinib, it has a better penetration in the brain. So that allows us to treat the brain metastasis better. The other thing about treating the disease in the brain is the location of the brain tumors, or the metastasis, so to speak, because the brain obviously controls certain neurological functions. Surgical options and even radiation sometimes is a challenge because that could potentially affect the brain function of the patient as a sequel of the treatment. So those are some of the challenges that we face when we're treating brain metastases.
Well, be sure to ask your questions. Use the chat on YouTube or Facebook. You can email the Medical News Network. That information is there on your screen. Jenny, you were chosen to participate in the Crucial Catch. That is the annual NFL initiative for the prevention and early detection of 7 screenable cancers. You participated in some of the Crucial Catch activities. What was this experience like for you?
It was pretty amazing. You know, it's interesting to get an inside look at some of the players' experiences that they have. And it was neat kind of seeing some of them come through. Travis walked through, and I tried to talk to him, but I think it was the day he announced his engagement to, what's her name, Taylor.
Good old what's her name.
Yeah, it was not a big deal at all, but it was a neat experience. And I have to thank the NFL for their attempts and what they do to increase cancer awareness and all with the Crucial Catch that they do every year.
Well, let's talk a little bit more about that, because the 7 screenable cancers that can be detected early include breast, prostate, cervical, childhood, colon, lung, as we've talked about this morning, and skin. But lung cancer is the leading cause of cancer death for both men and women worldwide, claiming more lives each year than colon, breast, and prostate cancers combined. And unlike other major cancers, lung cancer still is not routinely screened. Jenny was not a smoker, as we've mentioned, yet she was still diagnosed with lung cancer, which is just a reminder that this disease does not always follow the rules. But for people who are at risk, early screenings can save lives. Yearly screening with a low-dose CT scan can detect lung cancer earlier when it is easier to treat. And we're going to show you a list of things that can put you at higher risk. And I'm going to ask Dr. Reddy if he can kind of walk us through these and just explain them so people really can be on high alert.
Sure. So really anybody who's between ages 50 to 80, who's a current or former smoker, and who smoked at least 20 pack years is eligible. So a pack year is just the number of packs you smoke per day times the number of years. So for instance, if someone smoked 1 pack a day for 20 years, then that's a 20 pack year history, they would be eligible. If someone smokes 2 packs a day, then in 10 years, they're eligible. So basically anybody, again, current or former smoker, and you could have quit, if you were a former smoker, you could have quit any time in the past and still be eligible.
Well, if you think you may qualify, you can call 913-588-1227 to take a lung screening questionnaire and learn your next steps. I want to ask Dr. Wong, because Jenny had a period of no evidence of disease and then new tumors came up. How common is that with targeted therapy?
So unfortunately, that's very common. The disease can respond very well in the beginning and stay dormant or quiet for several years. But unfortunately, eventually some of the cancer cells, they acquire resistance against the drugs we use, and that's when we start seeing some of these new lesions start to appear.
Jenny, we saw you playing golf in that piece off the top of the program. How important has it been for you to just stay active?
Well, I think you've seen the picture of the grandchildren. You have to stay active for those little boogers. You know, who's going to run around with them in the backyard, and who's going to, you know, wrestle with them on the floor and do all the things that we do with them. It's important to stay active. I think for any of us it is. But you have to keep a positive outlook, and you don't dread on your disease, and you just keep moving.
Well, I think you mentioned it. Just how have you handled the ups and downs of living, because you are living and living well with cancer, and just how has your family helped you stay positive?
You know, I don't know how anyone would go through this without friends, family, and their faith. I think those are 3 of the most important things to have, and I'm very fortunate. Oh, and a good medical team. So we have a good team here, and I've grown pretty close to both of you, and my progress has been amazing. So
you said it took you a while, but you finally got them to call you Jenny instead of Miss Johnson after quite a while, right?
About 5 years.
Finally.
Yeah,
but that's great. They've become part of your family, I take it, right?
Oh, sure. You want to come over for dinner on Sunday? Okay.
Well, what advice do you have for someone then facing the same type of diagnosis? What would you tell them?
I would want to give them hope. I would want them to know that this diagnosis does not define you. I want you to focus on the positives. I want you to know that there are continued research and treatment modalities that are all improving, getting better, and never, never, never give up hope. It's a time to stop. It's really not a death sentence, it's an opportunity. So you just stop, you look death in the face, and you approach it. And you have a time to kind of sit back and think about your life and what's really more important in your life. And you can just start preparing. I mean, we are going to have the same end. You don't know how you're going to die, but this gave me an opportunity to make myself a better person.
And you're getting out there and spreading the word. Tell us about the gala that's coming up.
Oh my goodness. Yes, I'm getting out there. It's nice. I'm really trying to push lung cancer awareness. This lung cancer is affecting a lot more women, younger women. Some of the new patients that I've met are 42, 3 children, 6, 9, and 11. And I would want you to just be aware that this is, I think, a silent disease at first. If you have any reason, you know yourself best. And mothers, I think, really care for everybody else in the family. So don't take no for an answer. Be your own best advocate. And if you have any prolonged cough, fatigue, weight loss, coughing up blood, any of these things, go get checked. So,
Dr. Wong, how has Jenny's response to treatment changed the way that we think about stage 4 lung cancer today?
Yeah, I mean, since the EGFR mutation was discovered almost 20 years ago, that was one of the first mutations that we discovered in lung cancer that we then found a targeted therapy for it. And since then, there's now about 9 mutations that we have what we call targeted therapy for it. So I think it has changed significantly over the years how we treat lung cancer, but for the patients that don't have a mutation, we now have immunotherapy, and there's also changed the course of disease a lot of these patients. So definitely based on the mutations and some of the new discoveries in therapy, especially immunotherapy, it changed the way we treat lung cancer. We no longer just use chemotherapy like we did in the past.
And Dr. Reddy, for patients living longer with cancer, how is radiation being used differently today than it was even a decade ago?
Yeah, I think the biggest advance in radiation treatment for folks like Jenny and folks who are diagnosed with metastatic cancer is really the fact that we're really able to use SBRT now to do very targeted radiation treatment and treat kind of resistant sites of disease. So our goal is really to work in conjunction with Dr. Wong and colleagues in medical oncology to kind of keep the disease as controlled as possible. And sometimes when you have lesions that are not responding well, they're very amenable to being treated with very targeted radiation treatment, and we can do that safely. We can deliver a high dose, and we can do that with very minimal side effects nowadays many times.
So Dr. Wong, why isn't low-dose lung screening recommended for everyone the way mammogram is?
So it has to do with the study. The lung cancer screening study in the United States was done primarily in smokers, so that's why those recommendations were put out for patients who had smoked 20 packs a year. But in Asia, there was a study done in Taiwan in which it was done in patients with strong family history, non-smokers, and they also saw a high incidence of detection rate in patients who are non-smokers. So I think it just may take some time for that study to be accepted as one of the standard tests for non-smokers also to be accepted in lung cancer screening programs.
Want to get to some questions from our viewers this morning. Eric wants to know, why is lung cancer the deadliest cancer?
I mean, I would say that lung cancer is the deadliest cancer in many ways because it's often not diagnosed until it's in later stages. So things like lung cancer screening are so vitally important to being able to pick it up when it's not causing any symptoms. But before, people were using lung cancer screening, and nowadays for all the people who unfortunately don't, they usually don't get picked up until they have symptoms, and oftentimes at that stage it's a little bit more widespread.
Dr. Wong, would you like to add something?
Yes, I mean, just because of the number of patients, so lung cancer is the second most common cancer in men and women, but it's the #1 cause of mortality in men and women. So just to have an idea, the number of patients that die from lung cancer in men and women includes a number of breast cancer, prostate cancer, colon cancer, and pancreatic cancer combined. So you have just a much greater number of patients. And I think it also has to do with symptoms. Unfortunately, without early detection, a lot of these patients don't develop symptoms until the disease is already very late.
And through Jenny's advocacy, she says she's finding more younger women. Is it true that we're seeing an increase in women?
Yeah, so we are seeing in our clinic this disparity of two groups: the lung cancer that occurs in the traditional patients, smokers, and then we're seeing a rise, not just here in the Western world, but also in Asia, of non-smokers, women. And I think it has to do with some of the other environmental factors. We have other reasons that patients that are non-smokers can develop cancer, like radon exposure, air pollutants, and so forth. Family history, for example. So those cases, unfortunately, we're seeing more often nowadays.
Could you add anything to that, Dr. Reddy? Anything that you're seeing on your end?
Yeah, no, I think Dr. Wong summarized that perfectly.
And Beth asked, if you smoke more than 20 years and you stop, do your lungs heal at all? When does that healing process start? Is it right away, like they say?
Yeah, I mean, honestly, I think that's fair. I do think that there's a lot of healing that happens slowly over time. I think that the body needs some time to kind of get, its new baseline, if you will, and adjust to not having that irritant around that was there when someone was smoking. But it's definitely the case that the lungs continue to heal, and continue to heal the further you get out from when someone quit smoking. So, I would encourage anyone who's thinking that it's too late to quit, that it's not.
Never too late to quit.
That's right.
Day one.
That's right.
Day one matters. Jean wants to know, did you say whole brain radiation was used to get rid of 26 or 27 brain tumors?
No. Go ahead.
Well, fortunately, the disease responded very well to the targeted therapy, so Jenny did not have to have the whole brain. But in patients that does not have a mutation, and sometimes they're very symptomatic, then sometimes we have to use whole brain.
Yeah, and many times now we can use very targeted radiation in the brain, or stereotactic radiosurgery, so we don't really need to treat the whole brain unless someone really has so many lesions that it's just not possible to treat individual targeted lesions.
Aaron wants to know if you can get lung cancer screening if you never smoke, but you're still concerned about the disease. Is it easy to get by request?
Yeah, I think that might have some insurance challenges, because technically the rule is that those patients, the lung cancer screening currently is only approved for those patients. But I think if the patient has symptoms, obviously coughing like Jenny has, and the patient will probably be eligible to get a CT or chest X-ray at least to find out if there's anything else going on.
Dr. Wong, what's the big takeaway today? What do you want people to really, really get from our conversation?
So I think people should be aware that there's two categories of lung cancers: in smokers, the traditional patients, and the non-smokers. So if the patients are smokers, they would now have a lung cancer screening test that can detect lung cancer early, and it can cure patients. Unfortunately, the acceptance of the lung cancer screening is still very low. It's probably about 10–15% at the most, and even single digit in some states. So there's a lot of patients out there, they are eligible, they're not getting screening. The other fact is the patients who are non-smokers, if they have symptoms, persistent cough like Jenny has, they ought to seek their physician and get workup and find out what's going on, make sure there's nothing else going on besides a benign cough.
Dr. Reddy, what is the big takeaway today?
Yeah, I definitely agree that screening is so important, and as Jenny exemplifies, you have to be your own advocate. It's really important that you are paying attention to your body, paying attention to your symptoms, talking to your doctor if there's something you're concerned about. For those who are diagnosed at later stages, I would say there's a lot more hope now to living a long, healthy life and managing cancer, metastatic cancer, like a chronic condition. I mean, that's really where we have come as a field with the advancements we have, that we're trying to just allow people to live long, healthy, active lives with cancer using the state-of-the-art treatments we have. And the final thing I'd add is I always encourage everyone to really pursue treatment at, or at least an opinion, at an academic kind of cancer center like what we have here at the University of Kansas Cancer Center, because it's not just having kind of the state-of-the-art in terms of medical oncology and radiation oncology, it's clinical trials, it's just the whole team approach to cancer care.
And before we go, what are some of those first initial symptoms that should be a signal for somebody to see their doctor when it comes to lung cancer.
I mean, definitely, I think a cough that's persistent, usually people first go to their primary care physician, they're treated for an infection. If that's not resolving, then it's important to kind of pursue that further with your primary care doctor. And as Jenny did, and basically say, no, I really want some imaging, I want to see what else is going on. And outside of cough, I think, any symptoms that are outside of someone's baseline that are lasting too long, someone who's more fatigued than they usually are, someone who has, any kind of, neurologic changes, any of these things, I encourage people to kind of take seriously, especially if they persist.
Quick question for one of our viewers I want to get in. Jeremy says, I know lung cancer can be tucked away really far deep in the lungs. Is that a typical place, or can it really be anywhere in the lungs?
Depending on the type of lung cancer, squamous cell type of lung cancer tend to be more centrally located, so that can a lot of time trigger the cough. But the adenocarcinoma subtype sometimes can be more peripheral in the lung and be completely asymptomatic. So patients may not have any symptoms at all and unfortunately develop already a lung lesion, and that's why the importance of doing lung cancer screening.
And one last question is from Keith. Does secondhand smoke make you more at risk significantly?
Yeah, it can. I mean, again, it's exposure to smoking over time, that increases your risk, even if it's not you who's smoking. But if you're in an environment where you're seeing a lot of smoke, I mean, there's even studies that have shown now that people who are in areas where you've had big fires and forest fires and things like that, there are increased rates of cancer detection in folks, who've even had exposure to that kind of smoke. So,
Jenny, thank you so much for sharing your story with us and just being so open and reaching people. What do you want the big takeaway from your personal story to be?
Broken crayons still color. I want you to know that you beat cancer by how you live, by why you live, and in the manner of which you live. So if you're ever given something that you didn't ask for and you don't like, turn it into a positive. That's what I'm trying to do. You had asked before about our Lung Force Gala, which is here in town. I've gotten involved with them, and it is May 2nd this year here at Kansas City. It's in the Sheraton, out in Overland Park. We're expecting 700 people this year, a whole room full of people who are going to hear more of an awareness message, a push to give funds to promote our research that is so desperately needed in these days. We've got to continue research. We want to make this a thing of the past. We can do it.
I think your message on this Monday morning is the perfect way to start our week. So thank you so much for that.
Thank you. Thank you for having me.
Broken crayons still color?
Broken crayons still color.
Fantastic.
Yeah.
Doctors, thank you for your insight today. Really appreciate it. Thank you to all of our guests for being here with us. Thank you to our viewers for being here with us today. Coming up tomorrow on All Things Brain Health, Alzheimer's disease and dementia, they affect millions, but they affect each person and each family differently. We revisit one couple navigating Alzheimer's disease to show not all memory loss is the same and where they are finding hope for the future.
Subscribe to our morning medical update and Open Mics with Dr. Stites podcast. Now everywhere podcasts are available.